Hello everyone, welcome back to Dubai Healthcare Consultancy with a new vlog related to Assistant Nurse MCQs par Prometric Pearson VUE licensing exam par Dubai, Saudi Arabia, Oman, Bahrain, Qatar and Kuwait. If you are an assistant nurse and aiming to pass your DHA Dubai Health Authority licensing exam, DOH Department of Health Abu Dhabi licensing exam, MOH Ministry of Health Sharjah licensing exam, Saudi Commission for Health Specialty licensing exam, Oman Medical Specialty Board licensing exam, Bahrain National Health Regulatory Authority licensing exam, and Kuwait Medical Licensing exam. So this video is perfectly related to you. Today we will talk about the most important topic of the exam, which is related to assistance in diagnostic procedure. I would request to everyone to watch this video until to the end, so you will get more information. In this way, uh, you can pass your Prometric in-person VUE licensing exam. And I would also like everyone to like and subscribe this channel, so this give us motivation. In this way we will produce more videos for you, and these videos will definitely help you in your preparation for the upcoming licensing exam. So let's move to our topic of the day, and this topic is as I explained to you, the main topic is assistance in diagnostic procedure. So we will give you 10 most important questions. In this way, you can better prepare yourself for the exam. Once you watch all these questions, definitely if any question will come from this topic, so you will not struggle and you will perform in a better way in this topic. So the first question of this video is, before assisting with a diagnostic procedure such as a lumbar puncture, the most important nursing action is to. So option A is explain the procedure to the patient. Option B is ensure that the patient has signed the informed consent form. And option C is shape the puncture site. Option D is prepare the medication tray. So once you read all these four options, definitely you will understand that the most important, option and the most accurate option is option B. So what the nurse will do, the nurse will ensure that the patient has signed the informed consent form. If you will select this option, definitely your question you will give uh, correct option. You will select the correct option for that question. The next question is, when assisting in collecting a sputum sample for culture and sensitivity, the nurse should. Option A, collect the sample after the patient has eaten breakfast. Option B, use a clean dry container. Option C, collect the first early morning sputum sample specimen. Option D, mix the sputum with a tap water before sending it to the lab. So now here the focus on the question is like collecting a sputum sample. So as you know that the correct way to collect this one is collect the first early morning sputum specimen. So if you will select the option C, so this is the correct answer of the question. Let's move to the next question. The next question, question number 3 is, a nurse assisting with a bone marrow aspiration should position the patient in which of the following position? Always you will get question from positioning. So if you know the correct position for the procedure, definitely you will get a good marks. Here is option 1 is, option A, supine with arm rise. Option B, prone with a pillow under the abdomen. Option C, lateral decubitus or sitting position. Option D is Trendelenburg position. The correct option is option C, lateral decubitus or sitting position. Let's move to the next question. Question number 4. Which of the following is the nurse's primary responsibility during endoscopic procedure? Option A, provide the final interpretation of the result. Option B, monitor the patient's vital sign and oxygen saturation. Option C, perform the insertion of endoscope. Option D, prescribe sedatives for the patient. The correct option is option B, monitor the patient vital sign and oxygen saturation. Let's move to the fifth question of this vlog. And fifth question is, when assisting in thoracentesis, the nurse should place the patient in which position? Option A, lying supine with the head turned to one side. Option B, sitting upright, leaning forward on a bedside table. Option C, lying on the unaffected side. Option D, dorsal recumbent position. The correct option is option B, sitting upright, leaning forward on a bedside table. Give me your score in the comments until to question number 5. How many questions you corrected, so that will be great. And also give me your opinion about all these questions, how you are getting, what way you are getting knowledge from this question. We produce this question to you in proper way, or you think that something we need more concentration or any area of improvement, so you can recommend to us. Please give your comments in the comment section. Next, we will move to the question number 6. Before assisting in a contrast enhanced CT scan, the nurse should prioritize A, checking the patient's weight, B, checking for allergies to iodine or shellfish. Option C, offering a light meal. Option D, encouraging fluid intake. I believe that you would understand all these options, and I also believe that you will be able to select the correct option, which is option B, checking for allergy to iodine or shellfish. Always prioritize when a contrast enhanced CT scan is performing. Let's move to the next question, which is question number 7. When assisting in the collection of 24-hour urine specimen, it is important to option A, discard the first vivid urine at the start of the collection period. Option B, include the first vivid urine in the collection. Option C, keep the urine at room temperature. Option D, allow the patient to use a bedside commode without instruction. Always keep eye on each option and ask yourself, is this is the right option? Is this is the right option? So this way you will reach to the correct option. The correct option in this scenario is option A, discard the first vivid urine at the start of the collection period. Question number 8. During a lumbar puncture, the nurse observed the patient developing severe headache and complaints of dizziness. The immediate nursing action is to option A, reassure the patient that this is normal. Always ask yourself, headache and is this is normal? Always keep the scenario in your mind and then read the question. Question option B, notify the physician immediately. That's a kind of emergency, and this option is a kind of correct answer option. Ask the patient to immobilate. Will this option will make any difference? So ask yourself different question when you give the answer. Option D, administer an oral analgesia, but in this is immediate action will be notify the physician immediately. So option B is the correct option. Let's move to the question number 9. The nurse roles in obtaining a throat swab for culture include option A, ask the patient to rinse the mouth in antiseptic solution first. Option B, touching the tongue and checks while collecting the specimen. Option C, using a sterile swab to collect secretion from the tonsillar area. And option D, placing the swab in a dry envelope for transport. So ask, as I told you repeatedly, ask yourself what the question is asking. Am I giving the correct information regarding to the question? If yes, so it means you are on the right way. If not, it means you need more study regarding to the topic. So in this scenario, correct answer is option C, which is using a sterile swab to collect secretion from tonsillar area. The last question of this video is question number 10. After assisting in a liver biopsy, the nurse should position the patient. Option A, on the left side with the knee flex. Option B, on the right side with small filo under the puncture site. Option C, sitting upright on the edge of the bed. Option D, supine with the head elevated. So in this scenario, the correct answer is on option B. Option B is on the right side with a small filo under the puncture site. I am interested, that if you will tell me about your score in all these 10 questions. If you are scoring 7 out of 10 or 8 out of 10, it means you are on the target. And when questions coming from this topic in the exam, definitely you will be able to answer the questions correctly and you will getting a good marks. And that was the end of the video. And as I explained to you, like and subscribe our channel so you will get the notification once we upload any video related to Assistant Nurse MCQs. If you are interested to start your career in these countries, you are struggling for the registration process, data upload verification, and license exam booking, so you can contact Dubai Healthcare Consultancy. Our WhatsApp number is on your screen and we will assist you for the whole registration process. If you need more exam question, I will give you the link of our website in the description so you can subscribe or question bank. In our question bank you will find around 2000 multiple choice question related to different topics. In these questions when you study, so these questions will also help you in your preparation for the upcoming Prometric in-person VUE licensing exam. Thank you so much for watching this video, and I would also request you to share with your friends who are preparing for the same licensing exam as you. Thank you and have a nice day. Bye.